All right, everybody, this is language and students with neuromotor disabilities and TBI. We're going to describe the impact of neuromotor disorders on language development and educational performance, a little bit about remediation methods, and explain the impact of TBI can have on language and academics and what can be done to support those people. First, we're going to talk about cerebral palsy, which is a neuromuscular disorder. It's a heterogeneous group of non-progressive permanent disorders of movement and postural development. So heterogeneous in that, all kinds of different people and different ways that CP impacts them. It can cause dysarthria in children. Remember, dysarthria we talked about a little bit in class. Dysarthria is going to be a motor speech disorder where we've got a weakness in the muscle movement. So it's going to be pretty straightforward across all speech sounds while they're speaking. This can result from oxygen deprivation, brain hemorrhages, infections, toxins, malnutrition, alcohol or drugs during pregnancy, accidents during pregnancy. So pretty much the same as most of our disorders in our field. About 3.6 children per 1,000 children are going to have CP. It's the most common cause of chronic physical disability in children. And it's going to cause abnormal muscle tone. Remember, when we're talking about tone, we're talking about how much the muscles are tight. Loss of selective motor control, muscle weakness, and impaired balance. We've got 5 types of movement disorders recognized. We're going to talk about the 5 right now. We've got spastic hypertonia or hypertonic. This is going to be more than half of all people with CP. We've got spasticity, increased muscle tone or tension. We're going to have significant limitation in range of movement and significant difficulties with posture. Exaggerated stretch reflex. So as the muscles try to move, they're going to then try to go back to where they were, sometimes with a spasm. We're going to have damaged upper motor neurons are unable to inhibit signals that are going to increase that muscle tension. Movement's going to be jerky, stiff, labored, and slow. And in severe cases, the limbs may actually be rotated inward with the arms drawn upward and the head turned to one side. So that can have to require surgery as well, on top of the hypertonicity, which is going to be present all the time. The second most common, in about 30% of cases of kids with CP and adults, is going to be athetoid CP, where movement is disorganized and uncoordinated. The damage here is usually to the basal ganglia, and speech and breathing problems are going to be more severe than in other types of disorders. And here, so we're going to have a lot of involuntary movements with people with athetoid. So with people with spastic CP, they're going to have a really hard time moving. And here with athetoid, we're going to have a lot of involuntary movements of the arms, the legs, the head is going to be hard. That's going to really lead to a lack of control while trying to do something. All right, next we've got, in about 5 to 10% of cases, we've got ataxic CP. People with ataxia are going to have uncoordinated movement with disturbed balance. So difficulty with balancing, often overshooting when reaching for an object. Adults with CP will often say that people think that perhaps they're drunk or over-medicated. Again, they lack that balance. They don't have smooth movements. They're likely to spill things. In extreme cases, walking is characterized by a wide stance, head is forward, arms back. This is going to be injury to the cerebellum, so they're going to have a hard time monitoring information about balance as well as proprioceptive information from the muscles. The most rare is going to be rigidity. So this is going to be like people who've got spastic CP, except it's just sort of all over the body. So while someone's trying to move their arm and they're having a lot of difficulty and it's very hypertonic, that's going to be the full body for the person. So movement's really limited, and they have a really difficult time moving, speaking. But again, so this is the most sort of probably extreme and most rare kind. You can also have mixed CP, which is a combination of two or more of the types. About 40% of people with CP are going to have an intellectual disability. So, more than half will not, and about 80% will have a speech disorder. So, and that's going to usually be dysarthria. 20 to 40% of children with CP are going to have epilepsy, so they're going to have seizures along with the CP. Because individuals with CP can be very difficult to test because of the motor movements, probably fewer people have intellectual disabilities than come out with a test, because if you're asked in a receptive language or cognitive test to, point to the picture where the woman is walking, they're going to have a hard time pointing and things like that. So their other disabilities may be overestimated. Other related disorders that may occur in some kids with CP include delayed growth and development, impaired vision, hearing impairments are also a factor. So people have a hard time moving, and if they also have a hard time seeing and hearing, right, that's going to greatly impact what they're able to convey and communicate. Again, they might know and have a lot more language than we give them credit for. Children with CP are at significant risk for speech and language difficulties. So about 58% of kids are going to have a communication difficulty overall. School-age kids with CP report that about 40% of them will say that they have difficulty being understood by others. Right, so communication is a big factor here. Just from the speech standpoint, they're going to struggle in respiration, with breathing, in phonation, with being able to keep their voicing going. In resonation, they'll often be very hypernasal, and articulation, difficulty moving their tongue especially, is going to cause, again, that dysarthria is going to really play a role in their articulation. Differences in early development are going to often have an impact on language. So how their parents interact. So parents take a role of conversational dominance. Parents have reported to initiate most conversational exchanges, introduce the topics, ask a lot of closed-ended questions rather than open-ended questions, and issue a lot of commands. Right, so parents will be spending a lot of time helping kids with CP move, get dressed, use the bathroom, right? So there'll be a lot of commands, a lot of closed questions. So a lot of times kids with CP don't hear as much rich language as their peers, just because of the situation. Children with CP tend to reply with limited information and fail to take a similar number of turns, to initiate an equal number of exchanges, or to use a full range of pragmatic functions, because of that physical dependency. You might have shorter answers. You might be relying on others. Again, half are going to have, less than half, around 40% or less, are going to have cognitive limitations. And then also intelligibility. If people can't understand you, right, at some point you stop trying to say a lot and only use shorter utterances that you really need to say. So all of these are going to combine to kids using less language, they're hearing less language, right, and all of that can add up to a language disorder. There's a reason to expect that most kids with CP will have the capacity to develop typical language, although some are going to require AAC to express themselves, right? And for these kids, they're going to have a harder time with their motor movements. So things like using eye gaze technology and things like that are going to be huge for some of these kids. Children with CP often experience significant difficulty developing literacy skills. You know, if you can't hold a book, or if you can hold it but you can't keep it still, it's going to be really hard to read. They're going to have to be read too. So there's a lot going on, right? If parents also are spending a lot of time with the child dressing and using the bathroom and feeding and things like that, they're going to have less time then to read to them. So early home literacy is super important because there's not as much reading going on. Again, with the physical limitations, and kids with CP are going to have poorer phonological awareness skills, probably partly because of less book reading going on. So really working with them with that is huge. Speech therapy often focuses on developing the muscles used in eating and swallowing. So there's a lot of speech and swallowing going on. Teachers and SLPs can help develop literacy skills by giving them lots of opportunity to participate in literacy activities, listening to text, developing phonological awareness skills, trying to get parents to read to them as much as possible, are all going to be things that are really important. Some other neuromotor disorders we're going to talk about just briefly: spina bifida, muscular dystrophy, and epilepsy. Spina bifida is where the spine and spinal cord does not form properly. About 80% are going to have hydrocephalus along with that, and that is where water enters the skull and brain region, and if that water is not removed quickly, it can cause the brain cells to actually drown in that water and die. So hopefully people are able to remove that water right after birth when needed, and that if it's not, it's going to cause intellectual disabilities with the child. Overall, these kids are going to have strengths in vocabulary, in grammar, and your book talks about word attack skills, which is really just another word for decoding, where they're able to read, right? They're able to read the words fairly well. However, they're going to have difficulty with use of language in context. Sometimes their speech has been referred to as cocktail chatter, where they're able to kind of talk on a pretty superficial level about things, but that if they have to go any deeper, they're going to struggle. They're going to struggle with some academic skills, math and reading comprehension. So again, they're going to have pretty good decoding skills where they can read, but remembering, comprehending what they read is going to be much harder. Along with that, difficulty making inferences, understanding the story content, and producing their own stories is going to be a struggle for a lot of these kids. There's also muscular dystrophy. This is a progressive disease that produces weakness in muscles. So children are going to get weaker and weaker. Eventually, an inability to walk, to talk, and to swallow. There are 9 different types, so you don't have to know the different types. It's just important to know that this is a progressive disorder. It's going to get more severe in time. So it's important to take that into consideration when we're doing therapy with these kids. Finally, we're talking about epilepsy. This is a seizure disorder. It's a cluster of nerve cells or neurons that signal abnormally, so that the normal pattern of neural activity becomes disturbed. You have epilepsy. What the diagnosis means is that you have seizures and the cause is unknown. So it either has happened from birth or happens all of a sudden, and they can't figure out why. Then that person has epilepsy. It can cause disturbances in thinking and in language. Certainly during the time the person's having a seizure, right? But then if these are happening a lot, it's going to be really hard for a child to attend in school, to remember what they've learned. If they're having small seizures in the classroom, right, they might not even look like they're having seizures, but if they're having them, they're not going to be completely present during the day. So it's going to really impact them cognitively, language-wise. And you can have generalized epilepsy where you have the epilepsy in the right and the left hemisphere. Or you can have partial epilepsy where only one hemisphere is affected, and sometimes there'll be a hemispherectomy where they will try to actually separate the two hemispheres so that the seizures don't occur across the brain. Intervention-wise, most children with neuromotor disorders will need help with breathing, vocal production, and articulation. They should also be given lots of opportunities to engage in literacy-based activities, to communicate with a variety of people. So again, right, not that different from what we've talked about before. Reading, phonological skills, right? All the super important. And lots of time to talk, right? If you've got somebody who's in a wheelchair, we want to give them time to speak with their peers, speak with adults, right? Lots of times people are going to ignore classmates or kids who are wheelchair bound, so we want to give these kids lots of speaking opportunities. AAC devices can be a really important option for these kids. Just a couple intervention programs to talk about. We've got milieu teaching and It Takes Two to Talk. With milieu teaching, this is providing therapy in the child's natural environment. Goals and activities are going to be planned based on the interest and attention of the child, while natural reinforcements in the environment promote language growth. So really figuring out, right, what these kids enjoy and like to do, having language activities planned around that. We're going to read about what they like. We're going to do activities based on what they like. And we're going to give a lot of language models over and over and over again while we do that. Kind of related is It Takes Two to Talk, which is a hand-in program, which we actually use here at the App State CSD clinic. It's a parent-directed therapy, so the therapist actually trains the parents how to interact and to build language with their child. Let's just go to this website here. So it's going to be, right, for parents, how to be the child's most important language teacher. The program's going to show parents how to recognize the child's stage of communication and style of communication, so that they know which steps to take and how to interact. Identify what motivates your child to get conversation started, adjusting routines to help with turn taking and interaction, following the child's lead to build their confidence and encouraging talking, adding language to interactions, changing the way you play and read books, again, to engage and increase talking and language, and change the way you speak to the child, again, so that they'll understand and learn new words is all going to be a part of that. Okay. All right, and we're going to stop right there.